Hi, I'm Lou Goldstein with Chris Grant, and welcome to another edition of Open Source. Our guest tonight is Dr. Eddy Bresnitz, and I'm going to have Chris introduce Eddy to tell you a little bit about him and his background.
Thank you, Lou, and welcome, Dr. Bresnitz. I have had the privilege of knowing Dr. Bresnitz for quite a few years. He is a really internationally recognized expert in a variety of infectious diseases and planning, including pandemic planning. We'll talk about a little bit. He was trained in undergraduate work and graduate work and medical degree, got his medical degree from McGill University. And then for a number of years, he was both the professor, then chairman of the Department of Community Medicine at the College of Medicine at Hahnemann and Drexel. He has been involved in both state and federal activities, and he also has been a global advisor, having worked not only for public health, but also was a senior officer at the Merck Pharmaceutical Organization. He's had a history that he's seen a number of epidemics, including those that have affected New Jersey, not only HIV, but the West Nile virus outbreaks of the late 90s, early thousands, and certainly has spent a lot of time thinking and working in pandemic planning. So we are delighted to have him here today. His current role is as a senior medical advisor to both the Commissioner of Health in New Jersey, Dr. Judy Persichilli, and to the governor's office. So we have someone who really is prepared to give people what they need to hear. So Eddy, sort of starting out, we are doing this in the midwinter 2021, and nationwide we have 631,000 cases plus of COVID-19. I'm sorry, that's in New Jersey. Yes, much more nationally. 19,000 deaths in New Jersey, 2,900 plus current hospitalizations. And I'm not sure how many vaccines we've administered, but certainly New Jersey has had its rollout started and is underway. So it occurred to me, one thing we might start with is really sort of big picture and how you and your colleagues are seeing what we might call milestones for 21 as we proceed through winter into spring and summer. What are the big issues that you think we can make even more progress on?
Well, first, thank you to Chris and Lou for having me on for the session. Really appreciate the opportunity to basically provide some information and maybe educate your viewers. So when we think of the pandemic, the way I like to think about it is there's the disease side or the epidemiology side, and then there's the prevention or vaccination side. On the disease side, we've had our ups and downs in New Jersey. Clearly, we had our first bout with the virus back in the early spring and or late spring, early summer. Then we had sort of a quiet period until about September and October, and then we began to see a rise of disease right through to 2021. And we're now into February, and what the good news is that we're beginning to see a steady decline in not only the incidence of disease in the state, but also hospitalization numbers, ICU numbers, and even people are on ventilators. We're still at a very high level, much higher than we were last spring, but the trend is what's encouraging. And that has mainly to do with many of the measures that have been taken by the public, by the governor, policy directives on how to prevent disease even without the vaccine. So those include wearing a mask whenever out in public or with other people, trying to avoid trying to avoid gatherings with individuals, washing their hands, and just physical distancing at all times. We've had the benefit of adding vaccines to this beginning in mid-December. That has ramped up quite a bit. We now have about 850,000 doses, a little more than that as of last night, that have been administered to the state. And about 145,000 individuals have gotten both doses of one or the other vaccines that are currently available in New Jersey and the US. So, we don't have a specifically set milestone for disease in terms of, over time. I would say the ultimate milestone is we have no more disease, no more cases, no more hospitalizations, no more ICU admissions, no more people on ventilators. This summer, when we had, our nadir of infection, we had maybe about 400 cases being reported a day. Our deaths on a daily basis were in the single digits. We had really very few hospitalizations. And of course, you mentioned the numbers now, they've come back up quite a bit. So we're certainly aiming for what we had last summer, but even less than that. And that's going to take some time still.
How about on the vaccine front, as far as immunizations? Because this is a tough early period as people are trying to figure out their way into the system. But what is reasonable for the public to think? Is this an effort that will continue through the summer into fall to complete the immunization schedule you want?
Yeah, the short answer to that is yes. But I want to start off first by pointing out that from the time the virus was first identified as causing this illness, which was last January, a year ago January, to the time they basically had 2 vaccines made available from the FDA through an emergency use authorization, we had those vaccines developed and put out there and tested for both efficacy and safety. It's an amazing accomplishment by the private-public partnership of the government and the manufacturers. And as you know, since you've worked in industry, in vaccine industry, you know that it can take many, many years, even a decade times, to get a vaccine to basically licensure. And even adding an indication to a vaccine can take several years. So just having that vaccine available is amazing. We could easily have been in a position where we had no vaccines at this point because the 2 vaccines didn't work. The good news is that the manufacturers, the scientists, not just for these 2 vaccines, but for other vaccines that are currently licensed or available through emergency use authorizations in other countries, they all pick basically the same antigen to target the vaccine development. It's the spike protein of the coronavirus. And apparently that particular protein, when exposed to the body, generates a terrific immunologic response and results in the efficacy that we've seen with at least the 2 mRNA vaccines, where we're seeing 95% approximately overall efficacy. So I want to point that out as saying that we should be really happy that we're at the position that we're in now, understanding that the people out there in the world, in New Jersey, are a little bit frustrated with being able to get that first dose, let alone getting the 2 doses that are needed to complete the series. I will say that our target, at least initial target, our aspirational target in New Jersey, was to have 70% of the adult population vaccinated within 6 months of first launching the vaccine. I don't know if we're going to make that for a variety of reasons. We started off during the holidays. This is a massive, unprecedented, no blueprint program, no previous blueprint program, with the need to develop a lot of infrastructure to coordinate that program with the federal government, with all our providers. And so it's been a learning curve for all of us. But at this point in time in the country, we're doing about 1,300,000 vaccinations a day. In New Jersey, we're doing approximately 35,000 a day during the week. And so with each passing day, with more available supply from the government, and that's increasing as we move forward, we're going to see more and more people vaccinated. And as we do that, we'll get to that 70% aspirational goal, but I don't know that it's going to be within 6 months of when we first started. I started the response here with saying most likely in the summer or fall at some point, but let's hope for that. We also need to have children to be vaccinated. And right now, the vaccines that we have, the 2 that we have, and the ones that are coming online probably in the next month or 2, they're only approved for, well, in one case, 16 and over, but in other cases, only for adults 18 and over. There are trials going on with a couple of these vaccines, studying them in children down to the age of 12. And once we get through those, and assuming they get authorized or approved, they'll move down to even a younger group. So ultimately, we'll be wanting to vaccinate children as well, but we still have to get the data from these trials before we can actually see the FDA approve or authorize their use in that population.
Now, we know that two of the vaccines, both the Moderna vaccine and the Pfizer vaccine, have to be refrigerated. And there's as you mentioned, a third one from Johnson and Johnson that hopefully will be coming out to the market, fairly shortly. And I was wondering, and that's a one dose as opposed to the other two, which are 2 doses. Do you think having a 1-dose vaccine, which doesn't have to be refrigerated, will help to get more people vaccinated in a quicker period of time and could be given at different locations like drugstores, not just at super sites or specialty areas?
Yes, that's a great comment, and it's a good question. And what you've implied here that whenever you have a vaccine for targeting a particular disease or multiple vaccines targeting a different disease, they all have different attributes. They have not only maybe efficacy and safety, but they also have different storage and handling requirements as well. And so the 2 mRNA vaccines, even though they're both the same technology, the same platform for developing a vaccine response, they have different storage requirements themselves. The Pfizer vaccine requires ultra cold storage, at freezer temperatures of -70, and then when you take it out of the freezer and put it in a refrigerator and then actually reconstitute it, because it's a vaccine that needs reconstitution, you have certain requirements. The Moderna vaccine, also an mRNA vaccine, although it's the same platform, it doesn't require that ultra cold. It requires a freezer approach. And then when you take it out in the refrigerator, it actually can stay in a refrigerator for more days than the Pfizer vaccine. They both have to be used once they get to room temperature, but the Moderna vaccine doesn't have to be reconstituted with saline. The J&J vaccine, which is a different technology, it's a vector-based technology. It basically you use a non-replicating adenovirus to basically take, which has a gene inserted to it, and that's then injected to the body, and the gene then produces a spike protein, and the body then reacts to it and produces immunologic response. That's a 1-dose vaccine. As you mentioned, it's only requires refrigerator storage. Its shelf life is pretty good as well. I don't recall, it's 3 to 6 months. I don't recall exactly. And then the other vaccines that are sort of in the pipeline, more likely to be available than any other vaccines in the US, the AstraZeneca vaccine and the Novavax vaccine. The AstraZeneca vaccine is also a vector-based vaccine, and the Novavax vaccine is a protein subunit vaccine. They also require refrigeration and will be easy to use. The J&J one is the only one right now that I know of that's for 1 dose, although there was just some data released yesterday by the AstraZeneca folks showing that even 1 dose, if you, after 3 months, has about a 76% efficacy, not quite as good as the mRNA vaccines, but that's a 1 dose, that's after 1 dose, even though it's a 2-dose vaccine. So, in some cases, and in many cases, we're still learning much about the efficacy of these vaccines after 1 dose, even when they're a 2-dose product. We're learning a little bit about the durability of the vaccine as time goes on. We're learning that maybe 1 dose is maybe not good enough, but actually will protect people after a certain period of time, even before they get their 2nd dose. And that's important because sometimes people don't come back for that 2nd dose. So a lot of information out there. I guess that's a long prelude to directly answer your question, which was, will it be easier to use that? And I would say yes. It's a 1 dose. All these vaccines have side effects, typically local injection site reactions, pain, swelling, tenderness in the arm, and generalized reactions, side effects like fatigue or headache, sometimes with fever. And most of them are tolerable. They disappear within a day or 2. And most of the time people will come back for the 2nd dose, but sometimes people don't want to come back for the 2nd dose. Now, we've had had good response in New Jersey. Our data to date shows that over 90% of people who've have completed their 2nd doses, who've been vaccinated, who were eligible to get vaccinated, because we still have a lot of people who are not yet eligible for their 2nd dose. So it seems to be people are coming back. It will be easier to use those vaccines because they're refrigerated products and not frozen products in settings where it might be difficult to get to people. For example, practitioners' offices who may not have freezers and they don't want to go out and buy freezers. You know, that would be a requirement for the Moderna vaccine. We're not putting the Pfizer vaccine in private practitioners' office because they don't have ultra cold storage. Although we're not really much of a rural state, but in parts of the country that are rural, that have a lot of rural areas, a single dose vaccine that only requires refrigeration will also be of benefit. As you know, so it's next door in Pennsylvania, for example, we have a lot of rural areas. So the attributes of the vaccine in many cases can drive the logistics of distribution and vaccinating individuals.
So I'd like to go back to something you said when I was asking you about the milestones, and you said they're aspirational, and my experience over decades as well as that's very important to have some aspirational goals, not only for ourselves, but our families, our lives. And I think that is something that I'd like to underscore to the viewers. This is not something that is a date certain for anything. This is real life. It's like saying, well, when were the flowers exactly going to come up? Well, we don't know. And we don't know exactly when the sun will be out in a more permanent basis. But I think it's important to think about that. And it's in that spirit that I ask, as you think ahead, whether it's 21, 22, what, given what you're seeing with this disease, should the general public expect from a new normal? What remnants of our current behavior are likely to have to persist for some period, even after a large number of people are immunized? I was thinking, will people still need to be tested because people immunized at different points? Will there be some need? Maybe we don't know that yet. What kind of constraints? Certainly we're in a world of 7 billion people. Doesn't mean we might take off tomorrow for any place in the world, but could you just react to sort of set the mood of what we might expect, looking positively outwards?
Yeah. Well, I mentioned, as you emphasized, the aspirational goal is 70% of adults, within 6 months of starting. And just to put that into context, that's a pretty high aspirational goal for the simple reason is that when you look at the most commonly used vaccine in adults, the influenza vaccine, which is an annual vaccine, the best we do in seniors is about maybe 70% of the population. When you look at the overall vaccination for influenza in the population, in the adult population over 18, it's under 50% in any given season. Now, of course, a lot of people take influenza for granted. They don't realize that it actually causes a significant amount of illness and death every year. But, people don't pay much attention to it because it's a disease they think they know. So achieving 70% of the entire adult population would be quite an achievement. Now, you've probably heard many of the folks who in the media talking about the concept of herd immunity. I frankly don't like that term. It comes actually from data from vaccinating cattle and seeing what percentage of cattle in a herd had to be vaccinated in order to basically protect the entire herd. And so I like using the term community protection because that's what we're talking about. We're not talking about immunity in people who haven't been vaccinated. What we're talking about is getting enough people in the community vaccinated so it's hard for the virus to be transmitted from one person to another because the virus will be encountering enough people who have the vaccine and can't pass it on to those individuals. So you've heard folks like Tony Fauci of the NIH say that, at least initially 70% of community protection is what's required in order to basically stop or minimize the transmission of disease in the unvaccinated population or the population that's never had disease before. But we really don't know that it's 70%. It could be 80%, it could be 90%. Some diseases require 90%. Childhood diseases require 90% for for this community protection of those who weren't vaccinated for whatever reason. So with that in mind, it's not like a light switch is going to go on when we know that we're in the new normal. It's going to be more like a dimmer switch being gradually turned on, where one day we realize, you know what, we're not where we were 6 months ago, 8 months ago, a year ago. We're feeling better about going out in the public. Restaurants are open, not limited to seating. We can go to sports events, we can go to music concerts, opera, whatever it is you like to do that's indoors, where today would put you at risk for getting infection. Now, the big question that comes up, other than being able to go where other people are and congregate with them, is what's going to be the role of masks in the future? And that's a good question. For the immediate future, as people get vaccinated, they're going to continue to still have to wear masks and do all those other non-pharmaceutical interventions to prevent infection. And why do they have to do that? Well, we know that the vaccine works very well, as I mentioned. In the case of the mRNA vaccines, 95% efficacy, not just overall, but also in subgroups. If you break it down by gender or by age or by race and ethnicity, they also have equal protection. But we don't know yet for sure that the vaccine prevents transmission of the virus. In other words, you can be infected, have it in your nasal pharynx, not get sick because the vaccine is protecting you, but because you have it in your nasal pharynx, when you speak or basically interact with people and you're unprotected, you could transmit the virus to them. Now, there's data, there are studies that are going on to look at this particular issue. Actually, AstraZeneca released some information yesterday to suggest that their vaccine may prevent transmission. But until then, we're going to have to continue wearing masks going into the future. I do want to point out, by the way, that because we've had all these non-pharmaceutical interventions, like avoiding crowds and congregate settings and wearing a mask, we're not seeing the respiratory pathogens that we normally see this time of year. We're not seeing flu activity. We're not seeing other regular cold activity. We're not seeing the incidence of gastroenteritis that we normally do. And so the mask wearing is preventing not just COVID-19 or SARS-CoV-2 transmission, it's also preventing the transmission of these other pathogens, which is a good thing. So, when you think about it, if you think about it for yourself, you might think, you know what, maybe in the future, the new norm for me, especially as an older person, will be, I'm going to go out in the public, I'm going to wear a mask. They do this in Asia. If you've ever been to Asia or you've seen pictures, they wear masks all the time. Now, in the past, I have to say that I thought that was, what are they wearing masks for? I mean, public doesn't really protect them very much. I've had a change of heart in the last year, I can assure you. And going to those countries, or even our country, may mean that the new normal is wearing a mask all the time when you're out in the public. So I'm not sure what the other new part of the new normal may be, that more people will be willing to get vaccinated with the annual flu vaccine. I mentioned to you before what the numbers were on and previously not great in most of the adult population, better in the older population, but even 70% is not 100%. Now, we know a lot of people got the flu shot this year. I don't know what the final numbers are. The federal government and the manufacturers made much more available this year, and we know that there was great uptake. We'll see what the numbers of uptake are, later in the year after the flu season over, which is typically on April 1st. But I imagine we will see a much higher uptake of the influenza vaccine this year than we have in any previous year by all populations. Well, at least let's hope so. I don't know what else we would think about as the new normal. I think people will just be, it'll take some time for people to feel comfortable being together with other people who they don't know very well. I think that's going to take a long time, and particularly I think for people who are at higher risk, older people, people with underlying chronic disease, people who know that they were really much higher risk for getting sick from COVID-19, being hospitalized and potentially dying as well. I think particularly older people, you probably get asked about, do you miss going to a restaurant? And I have to say, we all like to go to restaurants, but I haven't starved in the last year. And of course, a lot of people have, have had problems with food security and income because of loss of positions and that. But people who are, otherwise reasonably well off have, say we're not in a restaurant, we'll do Zoom calls. We'll have a glass of wine over the internet. We don't necessarily have to get together with as many people as we had in the past. I think that might be the new normal for a lot of people.
Well, I was also sort of in the direction of people who have who are working remotely now, people who are commuting now still, or might have to resume it. Kids going back to college. I mean, this has been quite a dislocation for higher education. And then people who want to travel up to Canada, Mexico, California, and the kind of experiences that we may see. I don't think we really know, but these are issues that I think you've sort of set us on a path of the calculus that some of us will have to make, not a risk reward calculus as much as, if I want to really do this, what are some of the precautions I might want to take to protect myself? Very interesting question.
Yeah, and I was focused on the response of new normal just in general, but you mentioned a couple of situations where I could also comment in that the work environment. I mean, there's been lots of articles over the last year that have basically talked about the work environment and how people who can work at home and have been required to work at home, in fact, because their employers don't want them to come in. In fact, there hasn't been a loss of productivity for a lot of those people. In fact, in many cases, there's been an increase in productivity, maybe to the detriment of their personal lives, but they're not driving any longer. They're not, they are missing that social interaction at the office, but they're not spending a lot of time schmoozing either. And so, for many companies are probably thinking right now as well, maybe we need to reduce our rental footprint. Maybe we don't need that office building that's sitting empty because our people can meet at home. They can meet by Zoom and we can bring them together when we need to do that. Travel is a big thing that I think, and clearly the travel industry, the entertainment industry, the hospitality industry has suffered tremendously. And I think a lot of us would like to, who have traveled in the past and who like to travel, would like to be able to get back on the road and not feel like they're going to be unsafe going into a restaurant or into a hotel or to some other public setting. And I think that's going to be something that's going to start again, but we may approach it a little bit differently, again, coming back to wearing masks and things like that.
And I know we just have a few minutes left in this, the first of two segments, and we have going to cover a lot more next week. I would add to the work issue, however, we can't forget the essential workers. And for example, I've thought, are we going to still keep the buses and the trains as clean as we think we're doing right now in a new normal? That could be a plus, but it's something that the public has to think about.
Yeah. Are those plexiglass dividers going to be coming down, or are we going to be facing plexiglass dividers in any public setting?
Yeah.
Well, we'll continue our conversation next week with Dr. Eddy Bresnitz, as Eddy is the Senior Medical Advisor to the Commissioner of Health at the New Jersey Department of Health. And we'll be talking next week a lot more about vaccine distribution, vaccine hesitancy, and the mental health issues and other issues related around what's going on right now with the pandemic. So until next week, I'm Lou Goldstein with Chris Grant, thanking you for watching, and stay healthy, and we'll see you on another edition next week. Have a good night.